Hey everyone, welcome back to Digital Health Entrepreneurship Daily. If this is your first time here, my name is Seth Silvers and I'm here with Lee Black and Laurence Girard. And we all know that Laurence is the CEO of Fruit Street. And today we want to talk about how Fruit Street Health is one of the companies that has achieved full recognition with the CDC for its diabetes prevention program. But before we get into that, Laurence, tell us first off, like, what is your diabetes prevention program? Because this is a pretty big deal, isn't it?
Yeah, the diabetes prevention program dates back to a clinical trial that Medicare funded with an innovation grant where they wanted to determine how to prevent someone with prediabetes from developing type 2 diabetes. So they had enrolled thousands of patients with prediabetes into a clinical trial, and they had three primary arms to the trial. The first group was on a placebo pill, another was on metformin, and the third was in a lifestyle intervention that consisted of 22 classes with a lifestyle coach covering topics like diet, exercise, sleep, stress management, grocery shopping, cooking. The patients would write down what they ate, how much they exercised, and they would weigh themselves at every class. And what they found through that research was that the lifestyle intervention was more effective than metformin in preventing type 2 diabetes. The lifestyle group reduced their risk for type 2 diabetes by 58%. And that was published in the New England Journal of Medicine in 2002. And it's now one of the most famous lifestyle modification studies. And so the CDC took that research and they developed a national public health program where there's now approximately 2,000 organizations delivering this evidence-based program. Most of them are in-person programs at churches, hospitals, and YMCAs, and then some companies deliver it online, such as Fruit Street, where we do it through live group video conferencing on Zoom, where we have a dietitian and 20 people in a class. We issue them a wireless scale and a Fitbit, and they can take pictures of their food in our mobile application. And we basically report our outcomes data to the CDC every 6 months, and they essentially grade these diabetes prevention programs. So we've achieved the highest outcomes rating that you can achieve, called full recognition, which means that we've achieved things like 5% average weight loss for people that have participated for at least 9 months. Whatever, I'll just keep going. So this is the letter that you get from the CDC when you've achieved full recognition from Ann Albright, the director of the Division of Diabetes Translation. So,
can you make it bigger so we can read it? Fascinating.
Sure.
There we go.
So they give you this fancy letter from the U.S. Department of Health and Human Services, from the CDC as well, and basically just tells you that you've achieved full recognition with the CDC. So it's kind of like that CDC stamp of approval. So then when you go to payers and customers and investors, they realize that you're actually delivering high quality outcomes for your program.
It's like getting a verified badge on Twitter before you could buy them.
It's probably better than that, but
it's possibly a little bit better. So Laurence,
how hard is it to get this? Like, if I started a diabetes prevention program, could I get this in a year, or is this pretty challenging?
I mean, you have to actually deliver real clinical outcomes like weight loss and attendance of these classes. So it's pretty challenging. And there's people that try to get it that fail. Because the whole point is that this was the original publication in the New England Journal of Medicine. It's great that we have this publication, but it doesn't mean anything unless someone is capable of consistently delivering these clinical outcomes. And so it's kind of that stamp of approval that in the real world, you've actually helped people lose weight, for example.
So who is it that actually uses Fruit Street's diabetes prevention program? Is it employers who are companies? Is it health plans that send it to their members? Is it individuals who can sign up? Is it all three? Is there a fourth one that I'm not thinking of?
I mean, we sell it to self-insured employers and health plans who want to reduce healthcare costs by preventing type 2 diabetes, but we also have physicians who refer their patients and consumers who sign up. I'll just show you a quick video about the program.
Did you know that, according to the Center for Disease Control and Prevention, more than 1 out of 3 adults in the U.S. have prediabetes? In fact, 90% of those people don't even know they have it, which might include you or someone you love. The good news is that Fruit Street's diabetes prevention program can help you reduce your risk for type 2 diabetes by half by helping you lose 5 to 7% of your weight through diet and lifestyle improvements. During the program, you will be able to video chat with a dietitian and a small group of other participants on a weekly basis from the convenience of the Fruit Street mobile app or your computer. During each class, you will receive advice and coaching from a registered dietitian on topics such as diet, exercise, sleep, and stress management. Your dietitian will work with you to set small, attainable weekly goals that add up to big differences over time, improving your health and helping you reach your weight loss goals. At the beginning of the program, you will receive a free wireless scale to help you track weight loss progress. Just put the batteries in and it will already be connected to your Fruit Street account. It's that easy. After a few weeks of participating in the program, you'll have a chance to earn a free Fitbit to track your physical activity. In between each class, you will be able to take pictures of your food in our mobile application and receive feedback from your dietitian. When you sign up, you'll be able to pick a day and time for a weekly video chat with your dietitian. By signing up for Fruit Street, you can lose weight, reduce your risk for diabetes, and start living a healthier lifestyle. Enroll in the Fruit Street Diabetes Prevention Program today.
So yeah, that's basically what the program is, and it helps people with prediabetes lose weight through diet and lifestyle changes to reduce their risk of developing type 2 diabetes, which saves our healthcare system money and is better for patients.
Is there anyone who has had an amazing success story with the product?
I mean, we've had people that have lost, 50 pounds using the product that have said, it's changed their life and that kind of thing. We'll play maybe a few of them here afterwards, but I can just play one quickly, actually, right now.
Hi, my name is Arthur, and I have struggled with my weight since I was young. Because of my weight, I have been unable to enjoy life and have had plenty of health problems. So I decided to make a change, and the good people at Fruit Street have helped me do just that. Through the convenience of the Fruit Street iPhone app, I am able to take pictures of my meals wherever I am and have my nutritionist provide me with feedback. This really helps me stay on track by holding me accountable for the foods that I eat. My dietitian writes comments on the photos of food, which I can see in the Fruit Street app on my iPhone. I also wear a Fitbit Surge to track my physical activity, sleep, and heart rate. This helps me make sure I am living a healthy lifestyle, and my dietitian can see all of my Fitbit data to make sure I am staying healthy. Fruit Street makes it convenient for me to do our video conferencing with my dietitian and doctor from home or my mobile phone. During our video conferencing on Fruit Street, my dietitian advises me on my diet in addition to physical activity that I have tracked with my Fitbit. I've been using Fruit Street to work with my dietitian for a short time, and it has really helped me with losing weight and putting me on the path to a healthier lifestyle. When I first signed up for Fruit Street, I started at 558 pounds, and I am now down to 543 pounds. I hope to continue working with my dietitian through Fruit Street to continue work towards a healthier weight. I hope to continue my journey with them and get my life back. It's never too late to change, and most of us need help. Fruit Street has been the help and support I need, and I'm excited about our future together.
That is Arthur.
That's awesome.
Success story.
That's amazing. So, is Fruit Street, do you feel like you guys are seeing better results with your digital diabetes prevention program or your telemedicine solution, as opposed to the church groups or the programs that are being delivered out in person? Could you talk to us a little bit about that?
Yeah, I mean, it just makes it more convenient because patients don't have to drive an hour to a YMCA or a church for this program. I mean, there's rural areas that don't even have a diabetes prevention program, so it just makes it more convenient because you can video conference from home, and then the dietitian can monitor your diet and lifestyle, and everything's really just done at home. So it makes the program more accessible through the power of telemedicine.
So, Laurence, I think this is all amazing. Bringing it back to full recognition by the CDC, this stamp of approval that shows that you guys are evidence-based, that you're bringing these real life-changing results. What is the CDC and the government doing if anything, or should they be doing more to actually like get involved with helping prevent diabetes? Because I think in general, diabetes is it's a huge problem. It's a huge deal. Like your company's changing lives. So what is the CDC and the government doing right now to kind of help push this fight forward?
I mean, Medicare started paying for the in-person version of the diabetes prevention program, and there's a big push for many senators to get them to pay for the telemedicine model of diabetes prevention. So they are doing something about it. I mean, there's CDC has federal funding to organize these thousands of programs that want to deliver the intervention. And I think they could do a little bit more if Medicare began paying for these online delivery models.
And do you feel like that's enough, or like, do you feel like just more people need Fruit Street? Like, how do you see they're really like the solutions hitting the place where millions of people are avoiding, having diabetes?
Yeah. I mean, they need to change the farm subsidies ultimately so that they stop subsidizing corn syrup and they start subsidizing fruits and vegetables so that those are cheaper and more accessible. So that's part of the problem, and probably taxing, food that is less healthy, for example, the same way that we looked at like cigarettes as, first everybody thought, oh, cigarettes are healthy, blah, blah, blah. And then eventually, we have warning labels on them. Well, I don't know, maybe we need warning labels on Pepsi the same way that we do for cigarettes, right? So there's stuff like that that doesn't necessarily have to do with individual behavior. But then obviously if they paid healthcare professionals to educate the public about diet and lifestyle, that would also be helpful. So I think it's a combination of public policy and then these specific healthcare reimbursements.
Right.
Part of the problem with diabetes for me is, I just know nothing about it. Like I don't know anything about when to take insulin, like when to see is it an endocrinologist?
It is.
I don't exactly know what they do. They do endocrines. Bad joke. So does Fruit Street have a bunch of like knowledge and articles and so forth that help participants with staying healthy, picking the right food, stuff like that?
Well, it's based on scientific evidence. So the CDC maintains the national curriculum for diabetes prevention, which is a specific curriculum called the T2 curriculum, where it has a specific class for diet, a specific class for exercise, sleep, stress management. And so they provide standardization so that the whole country is delivering the same scientific program rather than just reading a bunch of articles about, diet and lifestyle on television. So that's the whole idea behind the CDC organizing this national program where there's this standardized scientific curriculum.
And when did this become a problem? Has it been the last 10 years? Is it the last 20 years? Again, I'm coming up from a not from a place of knowledge. Is it this decade, the last few decades? Or has this been big since forever?
Well, I mean, subsidizing corn syrup seems to have a lot of correlation with the rise of diabetes. So, I mean, obesity has become a problem like in the last, 50 years, something like that. So I think it has a lot to do with our food supply and fast food and that kind of thing.
All right. So here's a dangerous question, like, because I get a bit skeptical, and I'm sure maybe some listeners and watchers are skeptical as well. There's a whole bunch of ideas about reversing diabetes. Like, so what does that even mean? Like reversing diabetes?
Yeah,
like if you have something, you have it forever. Like, can you talk to that skeptic in all of us who is kind of doubtful?
I mean, I'm not the doctor here, and we'll get a doctor on the show to talk about this soon. But I mean, simply put, some cases of type 2 diabetes can be reversed, through diet and lifestyle modification. So it's definitely not true that all of type 2 diabetes is something you have for the rest of your life. In every single case, I think it depends on if you've had diabetes for 20 years or if you've had it for, a year. And if you improve your diet and lifestyle, your pancreas can recover and, you can kind of restore your body's ability to make insulin. So it's definitely reversible, but we'll get a doctor on the show to speak more intelligently about it than I can.
Yeah. And I mean, we talked a little bit before this interview about how like today the White House announced that they're making some changes. They're rolling out a plan that will make insulin more affordable for seniors and stuff. So it's like damage control. There's all these plans that are huge damage control. And I think that's why your work is so significant.
Well, why not just prevent diabetes instead of because then you wouldn't have to pay for insulin because nobody would have diabetes.
Right. And I mean, it's crazy how much
Type 2 diabetes, sorry.
type 2 diabetes, but how much less costs and burden on the healthcare system there would be if we were more proactive with things like health and pre-diabetes and different things like this.
Well, I mean, apparently there's several $100 billion in costs in the U.S. healthcare system from diabetes. So you would save thousands of dollars per person. I mean, definitely increase costs significantly.
Yeah, which everybody wants that. So I think this is really interesting. I think it's good for us to periodically come back to kind of the core product that's launched Fruit Street Health. And just to talk about it, to come back and see what is going on in your space, what's going on with your app. So Laurence, thanks for diving us into the maybe not always super interesting, but extremely important world of diabetes prevention.
Oh, it's interesting. Trust me.
Until next time.
Yeah, great.